Hi, this is Dr. Ilse Lugo, and today I'm going to show you 4 different cases. If you have one of these, you may need a tissue graft. So just take a look. Okay, so we have the first case. This patient is referred to us after having orthodontic treatment, and she is having some trouble with her tissue and how it looks, her root. I'll show you here. So here we have 2 kinds of problems. Here we have this huge gum recession. Of course, lack of tissue. And we have an insertion of our lip frenulum, which is gonna look right next to the gum recession. So in this scenario, we're thinking about doing a gum graft. Why? Because we need to cover the root and protect this root with a tissue graft and save this tooth. If we don't do that, then it's gonna cause bacteria around the root, and it's gonna eventually start getting loose, and we're gonna have to pull it out. So if you have a case or you have something in your mouth looking like this, we definitely have to treat it. And here we have our second case. With this patient, she came to us referring a lot of sensitivity around teeth that roots are, getting exposed. So if we look at this case, we see same problem, gum recession here, gum recession here, gum recession here, here, and here. Asking our patient when she started noticing about her roots getting exposed. She mentioned that she already had some surgeries done. The previous surgery, it didn't work so well. So I was kind of curious because most of the surgeries I don't do them again. I mean, when we are done and we have a good result. She said that she uses a hard toothbrush, and she does it really hard because she thinks she's cleaning really good, and that's the reason why gum recessions went back again. So this is really important for me. First of all, when I have a patient with gum recession, I always try to find the reason why we're having this problem. And this is the number 1 rule for all doctors and for all, periodontists that we do tissue graftings. We always have to ask our patient why. What was the cause? We have to find what's the cause of these gum recessions. Because if we don't change these habits, if we don't change the way that she's brushing, no matter how good me and the previous doctor is in doing gum graftings, it's gonna continue. It's a problem that we need to fix, right? Of course, we propose her to do a gum graft back again, and first of all, change the way that she is brushing so we cannot have the same problem again. Okay. Third case is about implants. So this is a really interesting case. Came to my office. This patient had previously so many surgeries in one side. There's a lot of things that we're gonna have to do with him, but I just want to show you guys how it looks when you don't have the right treatment and the right procedure around dental implants. So we see that this is a dental implant. This is another dental implant, which is inside his bone, and we don't see it, of course, but we see the crowns, and we see that the crown is really big. They're not even the same size, and they're not aesthetic good looking. We also see that he is having lack of gum, and just by looking at his lip here, he wasn't able to pull or move his lip because it was all inserted. The insertion of his lip was here where the crowns were. We have a really hard case to do, but it's not impossible. We need to first gain gum tissue and then from there I can, you know, start and managing and shaving his gums so we can have better results. We also see that he's having gum recession here. He's also missing the laterals here. But I mean, for this case, I just wanted to show you guys how it looks when you don't have the right amount of gum and your implants are of course compromised in these type of scenarios because you only have tissue, soft tissue covering around your implants, and that's really hard to, you know, to keep it clean. It's hard to even like eat sometimes because food it's getting stuck in there and you can damage your tissue there or hurt yourself. So there's a lot of things that we have to do in this patient, but like I said, I just wanted to show you how it looks when you don't have and when you might need a tissue graft, and more surgeries of course are need to be done here. But this is, if you have this or kind of your implants look like this, go see your periodontist, please. Okay guys, we have our fourth case, final case. I decided to pick another implant case because we have a lot of implant cases right here in the office, and I think it's really important if you have implants to try to protect and prevent any type of infection, because as we know, implants are not cheap, so we need to take care of them. We see that this case has lack of gum. His gums are thin. The implants are not fabricated to be exposed to the oral environment. It's not good to have them exposed because we can get a lot of biofilm around, and it's gonna be really, really hard to keep it clean. So this is gonna cause peri-implantitis, and eventually we're gonna have to pull them out and start all over again. Do gum graftings, and the implant surgery back again. Whenever, if you have implants and you see this and you have these scenarios, try to go and visit your periodontist and have different opinions and see which is the best for you to prevent any types of problems in the future. Thank you for watching. See you next time.